welcome back to Health and Wellness right here on K24 with me, Shiko Kaitani. We've got a good one for you this morning. We're talking about dental care and health. And we're asking that question, how well are you paying attention to your teeth? We're really here to actually encourage you to adopt better dental practices and, of course, talk about how to tackle some of the problems that you could be dealing with as far as your teeth and your gums are concerned. And most importantly, also learn a little bit about our brushing techniques. I said this before the break, you could actually be brushing all wrong. And yes, you'll say, but I do it every day. I know how to do this. What do you mean? But according to Dr. Gladys Maina, who is a dentist, at least one of the lead dentists at Royal Smiles Dental Clinic, she says that, by the way, a lot of people do not know how to brush their teeth. And we will be talking about that in just a few. But before that, let's get back to some of the common issues that so many of us are facing. And Dr. Gladys, welcome back to the show. We were just tackling some of the major issues that people have. We've got a few callers who are talking about sensitivity and bad breath. When you actually talk about cavities and gums that are diseased, that are causing this bad breath, what ideally then would diseased gums actually look like? Because you would think you would see ulcers if you're talking about gum disease, but how does it present itself?
Okay. Gum disease will most often present with, you may not notice, but at a dental visit, your dentist is likely to notice a redness on the gums, but most often your presenting complaint will be, my gums bleed. Yeah. But question is, why are your gums bleeding? If you're brushing well, using the right technique, the right type of toothbrush, not being too aggressive with your teeth, healthy gums should not be bleeding. So if you're having bleeding gums, either spontaneously on their own or as a result of brushing, as a result of having, say, food in your mouth, that's an indicator of gum disease. Another presentation of gum disease is sensitivity. Sensitivity that is non-specific. You present saying, generally, I feel sensitivity on my teeth, maybe when I'm taking very hot, very cold foods, or just at any point in the day, that could point to bleeding gums. Some people, like the caller who called before, I'm just suspecting when they say they have weak teeth, most times when you have an aggressive form of gum disease that has not been taken care of, then you'll start having teeth that are shaky and loose, because now the gum has been degraded over a period of time. And you see, the gum is one that offers support to our teeth. So if that has been compromised and degraded, then it follows that your teeth are going to be loose or shaky. Right. Yes.
Okay. Listen to some of these questions that we've received through our social media platforms, and thank you so much for that. Alphas Arap says, Doc, karibu sana, what's the home remedy for bad breath, tartar, and teeth discoloration? Keep that in mind, because we've got another one here that has come in from Whole Lotta, who goes on to say, how can you stop grinding your teeth while sleeping? Ooh, okay. Interesting question. Someone else asked the question at AOL, goes on to say, how much on average does replacement of dentures cost? And then we've got one here from Melly Simon, who says, I have a tooth problem, which keeps, or rather, I have a problem with my teeth, whereby my teeth keep on shedding without any pain, and almost all teeth have been affected. That's interesting. Okay. All right, so could there be a situation where teeth just fall off and and you're not being presented with any symptoms like pain and what have you, which is almost unlikely, I believe. I don't know. Yes, you tell us.
It's almost unlikely, but yes, I've encountered a few clients with such presentations, which of course is not normal, but then that often points to the fact that at the point of formation of our teeth, during our life period, and by the way, our teeth start forming when we are about 6 weeks in utero. Oh wow! When it's not even known what you're going to be, so they start forming early. So in the course of teeth formation, if the situations around, say, the pregnancy and even your early childhood are not favorable, then you'll then result in situations where you have teeth that the mineral content is not normal, the structure is not normal. So basically you'll present with teeth that are not normal. Okay. So they will be falling. So there's a likelihood that because of that and other factors could cause such to happen.
Okay, grinding your teeth while sleeping.
Yes, it's not uncommon. It actually happens to many people, and you may not know that you do that. And most times you'll have people reporting to you that that happens.
Oh.
So the advice is called Bruxism.
Yeah.
And others just clench their teeth, maybe if they're nervous or just, you know, without any prompts. So if you visit a dentist, that can be taken care of. You can have, of course, a proper diagnosis and treatment planning will be made for you.
Yeah.
Then you can have protective devices like mouth guards that you put in your mouth when you're going to bed. Then that helps to protect your teeth against grinding on each other, because when they're grinding on each other without any control, then they tend to wear out faster. So you'll have teeth that are flat on the surface, that are almost completely worn out. Then it becomes difficult for simple functions like chewing. But yeah, they should visit a dentist for proper treatment planning. And if they need a protective device, then that can be made for them.
Okay. I'll ask my director to let me know when we can actually move to our other side so that we can actually take a look at some of those brushing techniques and just understand where are we going wrong as far as how we brush our teeth. Are you doing it correctly? Well, let's move over to our other side, Doc, and then, of course, you can actually show us where we are actually getting it wrong. So I'm going to ask you to step with me onto this side. We've got a couple of models here, courtesy of the Royal Smiles Clinic. As you can see, we've got our teeth here. Something common that you would actually see once you walk into your dentist's office. You've got the little teeth here. Okay, so here we are. Well, let's start off with brushing. Number one, about shopping right. Where are we getting wrong? We're getting it wrong, rather, in terms of our choice of toothbrush, because you know this is Kenya, the economy is bad. Price really does matter. So I'll go to the supermarket and just pick whatever I can afford, but I could be picking the wrong thing or the wrong choice. So here we've got a number of toothbrushes, and of course I'm going to ask our cameramen if they can, you know, see this clearly so that at least our viewers at home can see what we're talking about. Okay, so here we go. Right. What is a bad toothbrush in your opinion?
A bad toothbrush is one that is, first of all, the bristles are hard as a scoring toothbrush. Yeah. And we have an example of one.
Yeah, this one, I'm assuming.
Yes, this is an example of a bad toothbrush, because if you feel the bristles, they're very hard. If you look at the tips of the bristles, they're sharp pointed at the tip. Right. So ideally, a good toothbrush should be soft to feel, like when you feel the bristles, it should feel soft or what you call medium. Yeah. Not as hard as this. This looks like it would be ideal for shoes.
Yeah, okay, because if you are picking a really hard toothbrush or at least hard bristles, what are we talking about damaging to your gums?
Yes, because you're going to be causing damage to your gums because it's very rough and tough. So when you're brushing, you know, the brushing movements, you're basically like scrubbing off the surfaces of your teeth and even the gums. So you're causing harm to yourself.
Okay.
This is not a bad toothbrush, but this is an old toothbrush. Right. Most of us don't actually pay attention to how long we use our toothbrushes. Right. So ideally, you should not use a toothbrush for more than 3 months or even less. Yeah. Because if it's a gadget, if it's a toothbrush you're using on a daily.
Yeah. Let me hold it so that at least our cameraman can get it.
Yeah. If you're using a toothbrush on a daily, then by the time the bristles are flaring out like this one, it looks like a broom. Right. It's not helping you.
I like that. It looks like a broom. You should definitely avoid. It needs to be trashed immediately.
It needs to be thrown away.
Okay, so every 3 months.
3 months maximum.
Okay.
Yes. All right. 3 months maximum.
Okay, so is this a good toothbrush?
Yes, this feels soft to touch. Yeah. And even when you look at the tips of the bristles, they are not sharp pointed. They're sort of rounded off. So what that means is that as the toothbrush is engaging your gums and your teeth, it's not causing harm to your mouth. Okay. So when you're searching for a toothbrush soft to touch, of course I know the packaging will be there, but you can tell. You can tell. You can actually tell. You can tell, yes.
Okay. So if I've got Toto in the house, where am I starting things off?
Well, you start off by, of course, at the initial ages, say between 0 to 6 months before they get their teeth, clean their gums with a clean piece of cloth or cotton wool.
Moms, have we had that? Even for me, I'm like, what? I didn't know that. So you should actually be cleaning their gums. You're
supposed to be cleaning their gums. And as soon as a tooth pops, then you start cleaning gently. Maybe 1 or 2 teeth may be difficult to use a toothbrush. Continue using your cloth. Clean cloth, clean water.
Okay.
Yes. Then as soon as they have teeth now, you start brushing for them. And when you're going to get get toothpaste for them, you use a very small amount. They say pea size.
Okay.
A very small amount on their toothbrush. You brush for them gently. Then even as they grow older, what I've found to work adequately for me is when I'm brushing, my daughter is there with me.
Right.
So as I brush, I demonstrate, and also for kids, you ensure that they are brushing twice. It may not be possible for you to be there at both the times in a day, but ensure at least one of the times there's an adult supervising and helping them to brush their teeth. Because otherwise they'll just end up swallowing the toothpaste and not
right,
brushing.
especially because it tastes good.
Yes, so what you've shown here are manual toothbrushes.
Okay.
Here is an electric toothbrush. It does also a good job. It's also particularly very important for people who say have physical disabilities, people who are not able to take care of themselves, the elderly. Electric toothbrushes come in handy. They're a bit pricey, but in the long run they do a good job.
Okay.
Yes.
Okay, and it saves you from, of course, all the problems that are, you know.
Then this is what we call interdental brushes.
Okay.
They are not very common, not very rare. You may have, if you look for it, you will find it. So these ones we normally use them for people who are having teeth alignment and they have what you call braces. In their mouth. You see, when you have anything new in the mouth, you're creating a new environment more conducive for dirt to accumulate, and now that follows that other problems will come in. But if you have braces, you can use this to clean.
All right, hold that thought. I understand we've got Kamau on the line. Good morning, Kamau. Do we have Kamau? Okay, unfortunately, we've lost him. So this is obviously ideal for those who probably have braces. Very perfect for cleaning because you're trying to get in between the little spaces and the metal. Yes. Okay, fine. Fantastic. We got that. So now here is the part we have all been waiting for, and that is how to brush your teeth correctly. Okay. So you were asking me on Friday, Shiko, do you know how to brush your teeth? And I said, well, I think I do. So is this what you usually use as your model to teach people how to brush?
Yes.
Okay.
Yes.
Okay, so let me use the good toothbrush. The assumption is I've picked this. And so are you supposed to start with circular motions and then work your way to the sides?
Perhaps specifically how you're doing the sides.
The sides. I would say circular motions to the sides, not...
No, show us what you do.
This is what I do. Honestly, this is what I do. I don't know if it's correct, but this is what I do.
Okay.
And then on the inside, still, because I know it's kind of hard to do the circular motions on the inside, but I'm going to try as much as possible to actually do still those circular motions. What I really try to avoid for me, I don't know about other people, is doing this.
Okay.
You know.
Like you're polishing shoes.
Yeah, like I'm polishing shoes, by the you know. But sometimes when you're in a rush, I know this is what does happen, because even for me, I probably will get there. Same thing for the top, and of course on the sides. How do I brush my front teeth?
Yes.
Like this.
And on the inside?
Like that.
Okay.
I don't know. And then for the tongue.
And okay. Well,
so am I somewhere?
You're on the right track.
I'm on the right track.
But the advantage you have is that we had a session with you, so
no, but you did show me how to do it. So okay, George from Garissa is on the line. Let's talk to George, and then of course we're gonna get back as you're preparing. Yes, good morning.
Good morning to you, Shiko and the Tari.
Yes, morning.
My name is George. I'm calling from Garissa.
Okay.
Yeah, now I recently went to see a doctor, a dentist actually, last week on Tuesday.
Yeah.
And I had issue with my teeth actually. I had a tooth. Is it a molar? I think it's a molar uko nyuma. That had been filled when I was 10 years old.
Yeah.
And then when I was around 15 years old, the seal came off. And since then, right now I'm 36, I've never used that side of the mouth for chewing. So ile uchafu ilikuwa imejaa because ile shimo ilikuwa na uchungu when I brushed. So I never brushed that side. I never chewed with that side. So you can imagine all that uchafu had piled up.
Wow.
So when the dentist cleaned that side for me, na kafili Oshimo, he told me to try and chew with that side so that it can get used to chewing and it can self-clean also.
Wow.
But now since last week, that tooth has been aching a bit. Alafu that gum, malimshimo iko, of that tooth inauma. I don't know if I should go back to him or I just continue trying to brush my teeth and chewing with that side.
Okay, thank you so much for that, George. Wow. And I would say George has a really interesting point. Okay, I understand there's also... Okay, fine. So Shege, we've lost Shege, but anyway, thank you so much for calling in nevertheless. George, suffering in silence, and I think a lot of us do so, because can you imagine that life? You're chewing with one side because the other side has such a deep cavity, and he said he's been having this problem for the longest. So what do you think is going on there?
Well, it just points out to a dental issue that has not been addressed in a long period of time, and him sitting without it being addressed is just perpetuating the problem, because if he's chewing with one side, that means one side of his mouth is being overworked compared to the other one. And you see, we have a problem that has been silent for some time, and now it's starting to show up. So my advice would be that he finds his way to a dentist as soon as possible and have the problem addressed, because now it started as something small. Now it progresses. Goes to the gums, goes beyond the gums.
Yeah.
Could even have a very bad infection as a result of that. So the advice is that as he does his cleaning, he needs to go to a dentist and have the problem addressed as soon as possible.
Okay. All right. So now show us how to brush.
Okay. So you get a good toothbrush, soft to medium bristles. Then, of course, bristles that are rounded off at the tip.
Yeah.
Then you have your fluoride, a toothpaste that has fluoride. Then get a small amount on it. Then when you're starting to brush, my advice usually is be intentional.
Yeah.
Spare at least two minutes to 3.5 minutes at a time to brush your teeth.
Okay.
Don't be in a hurry. If you're not in a hurry to clean the rest of your body, please don't be in a hurry to do the same with your teeth. I mean, the teeth are a representation of who you are,
Right.
So therefore then, my advice is, usually I advise that you start from the back. When you're holding your toothbrush, we say you angulate it, well, theoretically 45 degrees, but at an angle, not upright and not straight to your teeth. So your toothbrush should be forming an angle with your teeth. Start at the back and be intentional. By being intentional, I mean ensure that you're touching every tooth you have in the mouth, especially the back teeth, because those are the ones that tend to be neglected a lot.
Right. Okay.
So when you have this is your mouth, this is your toothbrush. At an angle, start from the very back of the last tooth.
Right.
You do small circular motions. It may sound cumbersome, especially if this is not what you've been doing on a regular and you're starting to adopt to it, but be patient with yourself. Small circular motions. And the beauty of the small circular motions is that you're touching on every aspect of your tooth.
Okay.
You do that as you come to the front. Be intentional. Do not skip any teeth.
Yeah.
Move it slowly. Don't be in a hurry. 2 minutes is not a long time. So when you come to the front, the small circular motions may be a bit difficult, especially on the inner aspect, but on the outside you can do small circular motions. Repeat the same. Then go to the inner aspect of your teeth. Be intentional as well. Start from the back, small circular motions. Your toothbrush held at an angle, not a right angle.
Yeah.
They say 45 degrees, but you know.
Yeah.
Like
as
this.
best as you can.
As best as you can, yes. But avoid the back and forth movements. This is not shoes we are brushing. And also, don't use too much force. There's also the issue of you're brushing well, but using too much force from your arm. Be gentle. If you're using too much force, then you're being aggressive.
Right.
Don't.
Okay. Hence why even some of us are still dealing with bleeding gums because of that.
Yes, because if you're doing that, then you could cause trauma to your gums. Be gentle. Don't use too much force. Then remember to brush the top surface, the chewing surface of your teeth, especially the molars and the premolars.
Yes.
These ones you can do small circular motions, a bit of back and forth. Then for the lower side, the circular motions may be a bit cumbersome. Do small sweeping movements to the outside.
Oh, is that it?
Yes, small sweeping movements. Then you go to the upper jaw, you do the same thing. Be intentional. Ensure you start at the back. Don't be in a hurry. 2 minutes is not a long time. Okay. Basically, you repeat this. Then the one thing that people tend to forget is that your tongue holds more dirt than even your teeth. Oh, wow. Okay. So remember to brush your tongue, and you're brushing outward movements. Okay. Then sorry. Yes. Then another way to take care of our teeth that most of us don't do is use of dental floss. Okay, so here we are. I'm holding some floss. Yes. Doc, a lot of people will say this is just an added expense. I really don't need to floss my teeth. You actually need to. because even as good as you are with your brushing, there are areas that your toothbrush will not get into. Some of us have very tight teeth, so the spaces between our teeth, our toothbrushes cannot get there, and they hold a lot of dirt. So you need to get waxed dental floss. It's 300 bob mostly. It will take even 6 months, and you really need it. So there's this type. There's some types that have like a handle. So usually it's cumbersome to use at first, but I advise people to stand in front of a mirror, cut a length that's comfortable for you, wrap it around your index fingers on both hands, stand in front of a mirror and slide it into and out of your mouth gently.
Okay, fantastic.
Yes.
You want to do that? You're spoken like a true dentist. No, it's okay. We don't need to floss on TV, but
so you stand in front of a mirror, and learn to do it at least twice a day, or even once is good enough. And you get to clean, and the areas between your teeth are where decay will happen most times.
Okay. So thank you so much for that. There you have it from Dr. Gladys Maina from the Royal Smiles Clinic in Ruaka. Gentlemen, karibuni sana. Look at our well-displayed set right here as we talk about how to take care of your teeth. Lots of questions, of course, on bad breath. Why are we getting cavities, bleeding gums? It really just boils down to this.
Had her mention that if you have a cold, you have a sore throat.
On that note of a cold, please stay away from Boofy, because we all know whatever he has really morphed into something else.
That's why he's looking dull today.
By the 4th week of a cold, it's not a cold. It's a condition.
You said 3 weeks, so now it's 4 weeks.
It was 3rd week last week. Now it's the 4th week. My goodness.
The point is, you said that if you have a cold, sore throat, you're obviously prone to have bad breath. So what should you do to? Cause I mean, if you have a cold, there's nothing you can do until it clears after 4 weeks.
There's a lot you can do. First of all, colds, most colds are viral infections. So what happens is that we do symptomatic management. So in that period when you're doing symptomatic management, we're just managing your symptoms. If it's a fever, antipyretics, painkillers, maintain your oral hygiene. At that point, depending on how bad the situation is, you may be advised to switch mouthwashes. Yes, then...
Na wala watu fanyanga na sukari, si sukari, chumvi. Still works?
Chumvi is good, but it's not adequate by itself.
Yes.
Then you change your toothbrush after every cycle of a flu.
So like tomorrow I change my toothbrush now?
No, ukipona.
So in December, get a new toothbrush.
Unapona kesho.
Okay, so we're going to ask you to keep those questions coming in. If you've got anything that's pressing that you want us to forward to Dr. Gladys, we will be happy to do so. But gentlemen, as we say goodbye, and a big thank you to the Royal Smiles Clinic, we want to wish them a happy birthday. They're turning 5.
Wow,
happy birthday! And of course, to the entire team, thanks a lot for coming through to educate us. And now you see the importance of keeping up with those appointments.
And flossing. And flossing. Please floss away. Of course, we are done. Up next is, of course, the daily brief from 9 up until midday, looking at all the big stories of the day. KCSE day 1, so of course, keeping a keen eye across the country as to how that pans out as far as that's concerned. We're going to say a big goodbye from us right here. We're back tomorrow bright and early. Even as we go, we have an award for the person who talks the most recklessly right here on the show. Booby, this is for you. Keep this award. And have a good day. We are back tomorrow. Bye-bye.
Really? Really?